I was very familiar with the original founders of our program from the mid-'80s, and I was very drawn to their mission, that of the hospital, but also of theirs, which was to train physicians who want to work in underserved communities such as the one that we live in.
The roots of the program was actually founded by 6 Latino physicians at the very start, and so that was a very unique part in this Boyle Heights community, which was something that hadn't been done before, and so that's always been, I think, in the DNA of the program.
My focus is more on the academic side of things, so improving curriculum and helping develop both residents and faculty in cultural humility and awareness and how we care and serve the patients in our community.
I was originally actually came here as a resident, and I had done a rotation as a medical student. And for me, the big attraction was just the residents who were here and the faculty and the community that was there.
One of the hospitals that I knew I wanted to apply is White Memorial. My uncle was hospitalized here. He was treated for cancer. He always talked about how good of a quality care he got. And that was one of the things that drew me into applying here.
Culturally, this is the community I grew up in. Coming from Long Beach, San Pedro, Torrance, and ultimately settling in San Ysidro, this is like home to me. So being able to provide and give back to the community that I grew up in has been such a huge gift for me.
We really are working in a very world-class hospital, different technologies. We have great specialists in a lot of different areas.
White Memorial is one of the few hospitals that still has the peds floor, so I am in the peds playroom. A lot of other residencies actually come here to do their peds because they no longer have peds floors. And so we're fortunate in that residents tend to spend their entire first year here on campus, most of their second year, and third year by choice, they can go off campus to do other things.
We really work to make sure that we have a strong pediatric training, adult inpatient training, and the training is quite intense. It is definitely very challenging.
This is not going to be one of those easy family medicine rotations. That is intentional. We know that we continue to be very inpatient heavy because we know that that is how you become a great physician as it translates to outpatients. Here you're going to be highly sought after when you graduate. Very, very high acuity patients. You learn a lot.
It's really with the idea of making sure that you are really well trained for no matter what setting you go on to practice in the future, you're not going to be limited by the experiences you had in your residency program.
One of the most special things about this residency is that there's a lot of diverse diagnoses and diseases and a lot of different pathologies. Every day I get to see something different. Every day I get to learn something new.
One of the skills that I feel like I've learned and that is absolutely invaluable, especially in this healthcare system, is knowing all of the different ways that I can get the kind of resources or care for my patients.
One of the things that I learned since starting here is being able to be very thorough with my examinations and be very thorough with the way I ask questions.
I think it's the relationship that we build with the residents. I have a very good open dialogue with them. I see them grow into these caring, wonderful physicians that are highly sought after, and that their success brings me great joy.
Everybody's kind of like a family, and I feel like everybody has embraced me in a way that I wasn't expecting. I've been able to find a lot of support within my attendings and my co-residents, and everybody has been very nurturing, supporting, and just trying to help each other and just being able to grow together.
I think is making sure that we teach our residents wellness. Wellness means different things to different people, so helping them learn ways to adapt what makes them well into the time frame available for them to do so. GME, or Graduate Medical Education, has put a lot of effort into wellness, not only didactics, lectures, the gym, the Zen room, mindfulness.
Community medicine is a very strong part of our program.
Just working in this area, you get that sense of appreciation of all the patients you meet, and you get to peek into their lives at their weakest, and they trust you implicitly.
An important part of our program is our community service, and so we always do a lot as far as working with different high schools in the community, undergraduate colleges.
I love the fact that from day one that I started this program, we were out in the community. We went to some of the museums that told a lot of the history of this area. We went to Mariachi Plaza, and it allowed us to just kind of get immersed.
Caring for patients and being able to not only just care for them, in their diseases, but also care for them as a whole person. I think that's really important.
If you do really want to have a more intense hands-on training where you're much more involved in the patient care, you are going to learn so much here.